Hey guys, today we are joined by Miranda and we are going to talk about golf injuries. The two most common golf injuries that we see are shoulder pain and low back pain. Okay, so first let's talk about shoulder pain. A lot of times this is actually caused by a lack of mobility through the thoracic spine, and whenever we have this, we end up developing some mobility issues in the shoulder. And whenever we have that, we end up with a lot of discomfort. So a lot of times what you'll notice, and you can try this at home, is you have a loss of mobility in what's called external rotation, bringing that arm up, and or internal rotation, bringing the arm all the way down. And like if you try and at home, bring your arm behind your back, and you bring that behind your low back, and can you lift it off of the low back, and how long can you hold it up there? Is there any pain? And bringing that arm up, how far can you bring it back? Do you have any pain right here in the front of the shoulder? And is it restricted? Very commonly we develop that with shoulder problems, and a lot of times it's also related to stiffness and mobility in the mid-back. So a lot of our golfers, when you guys come in with shoulder discomfort, we're going to take a really good close look at the mid-back, the neck, and the shoulder. We'll find probably some problems in all of those regions, and then we'll work on it typically with some muscle work. Maybe dry needling, because dry needling is fantastic for it. Occasionally some Graston to work out the muscle problems, and probably some hypervolt just as a massager to work on some of those muscles. Also, typically we end up with a lot of low back pain, and it's because golfers, we try and push and rotate too much through our low back, and the lumbar spine, the low back, is not designed for rotation. So if you're trying to build up a lot of strength and flexibility in your low back for golf, you're actually doing it a little bit wrong. You need to focus on flexibility and strength through the hips and the mid back, all right, and stabilize the lower spine, all right. So if you stabilize the low back, you're actually going to do a whole lot better and avoid a low back injury while golfing. So we see this all the time where people are trying to do too much through the low back, and then as a result you end up with a low back injury because of you hurt yourself during one of your swings. Okay, so with patients like that, we typically do a lot of core work, stabilize the core, but also some muscle work to, with the hypervolt, to relax these muscles, and usually spinal manipulation, the chiropractic adjustment. So let's demo really quickly what we do with the hypervolt. This guy is an awesome percussive massager. We use it practically on all of our patients. Patients love it, and they end up always just buying it on their own. It's a percussive massager, meaning that instead of vibrating, it actually goes in and out. And we are able to loosen up a lot of the knots in the low back and help these muscles start to relax. And you're gonna want to get all of the low back. The paraspinals are the muscles that actually go up and down. You're gonna want to get the glutes and the piriformis, because again, we need the flexibility and the strength through the hips in order to do the rotation that we need for the golf swing. You're gonna want to get the upper spine, the paraspinals up through there. And even into here and through the upper trap and through the shoulder. Okay, so again, what we're really aiming to do is increase mobility through the thoracic spine and the hips to help with our low back pain and our shoulder pain that we see most often with our golfers. All right, if you have any questions, just send them my way. Always remember to live with passion, not pain.